Have you ever stood up a little too quickly and suddenly felt like the whole world was spinning? Your vision gets blurry, you feel lightheaded, maybe even a little nauseous. You grab onto something to steady yourself, and after a few seconds, it passes. If this sounds familiar, you're definitely not alone. This common experience is often called a head rush, but its medical name is orthostatic hypotension or postural hypotension. And while it's usually harmless, it's your body's way of sending you a signal. Today we're going to decode that signal, understand why it happens, and learn some simple, effective ways to manage it. Trust me, you'll want to stick around for this, especially if it's happening to you more and more often. So, what exactly is going on in your body when you feel that dizzy spell? Let's break it down. When you're sitting or lying down, gravity is pulling your blood down into your legs and lower body. It's just chilling there, not having to work too hard. But the moment you stand up, everything changes. Gravity suddenly pulls about half a liter to a full liter of blood down into your legs. Your body has a brilliant lightning-fast system to counteract this. Special sensors in your arteries, called baroreceptors, detect the drop in blood pressure. They immediately send a message to your brain, which then tells your heart to beat faster and your blood vessels to squeeze tighter. This pushes the blood back up to your brain, ensuring it gets the oxygen it needs. All of this happens in a fraction of a second, and most of the time you don't even notice it. However, sometimes this system doesn't respond quickly enough. There's a slight delay. During that brief moment, your brain isn't getting enough oxygen-rich blood, and that's what causes the dizziness, lightheadedness, and blurred vision. It's like a momentary power outage for your brain. Now, for most people, this is a rare occurrence. But if it's happening frequently, it could be a sign that something is interfering with this finely tuned system. So, what are the common culprits behind orthostatic hypotension? The number one cause is surprisingly simple: dehydration. When you haven't had enough water, your overall blood volume decreases. Think of it like trying to run a plumbing system with not enough water in the pipes. There's less fluid to go around, so it's much harder for your body to adjust your blood pressure quickly when you change positions. Are you drinking enough water throughout the day? For many people, simply increasing their fluid intake can make a huge difference. Another big factor is what you're putting into your body. Certain medications are well known for causing this side effect. These can include diuretics, often called water pills, which are used to treat high blood pressure. They work by making you get rid of excess salt and water, which can lower your blood volume. Other culprits include certain antidepressants, medications for Parkinson's disease, and even some over-the-counter drugs. If you've recently started a new medication and noticed this dizziness starting, it's definitely worth having a chat with your doctor. They might be able to adjust the dose or find an alternative. Our daily habits also play a huge role. Have you ever noticed it's worse in the morning? That's because you've been lying down for hours and your body is in a state of rest. Standing up is a bigger shock to the system. Similarly, standing up after a large meal can trigger it. When you eat, your body diverts a lot of blood to your digestive system to process the food. This leaves less blood available for the rest of your body, making it harder to maintain blood pressure when you stand up. And let's not forget the heat. On a hot day or after a hot bath or shower, your blood vessels dilate to help you cool down. This can also cause a temporary drop in blood pressure, making you more susceptible to that head rush. As we get older, our bodies naturally change. The baroreceptors that detect blood pressure changes can become less sensitive, and the response from our heart and blood vessels might not be as quick as it used to be. This is a normal part of aging, but it means that older adults are more prone to orthostatic hypotension. While it might be common, it's not something to ignore, because the biggest risk associated with this dizziness is falling. A fall can lead to serious injuries, especially for older individuals. So, now that we understand the why, let's talk about the what to do. The good news is, there are many simple lifestyle adjustments you can make to manage and even prevent these dizzy spells. First and foremost, stay hydrated. I can't stress this enough. Aim to drink water consistently throughout the day, not just when you feel thirsty. If you're active or it's a hot day, you'll need even more. Next, be mindful of how you move. The key is to make transitions gradually. Instead of jumping out of bed in the morning, try this routine. First, sit up slowly on the edge of the bed. Dangle your feet for about 30 seconds to a minute. While you're sitting there, you can do some simple exercises to get the blood flowing. Try pumping your ankles up and down like you're pressing a gas pedal. Or make circles with your feet. This activates the calf muscles, which act like a second heart, helping to pump blood out of your legs and back up toward your chest. After you've done that for a bit, then stand up slowly. And when you do stand, make sure you have something sturdy nearby to hold on to, just in case. Let's talk about diet. If you notice dizziness after meals, Try eating smaller, more frequent meals instead of 3 large ones. And be mindful of your carbohydrate intake. Large carb-heavy meals can sometimes worsen the problem. Adding a little more salt to your diet can also help, but this is a tricky one. For people with high blood pressure, this is generally not recommended. So, it is absolutely crucial to talk to your doctor before you start loading up on salt. They can advise you on what's safe and appropriate for your specific health situation. Compression stockings can be a game changer for some people. These aren't your average socks. They're specially designed to apply gentle pressure to your legs, which helps prevent blood from pooling there. This provides support to your circulation and can significantly reduce symptoms. You can get them in different compression levels, and your doctor or pharmacist can help you choose the right kind. Also, review your medications with your doctor. If you suspect a medication might be contributing to your dizziness, don't just stop taking it. Have a conversation with your healthcare provider. They can assess the situation and determine if an adjustment is needed. They are your best resource for managing your health. Now, while these tips can help in most cases, it's also important to know when you should see a doctor. If the dizziness is new, frequent, or getting worse, it's time to get it checked out. If you faint or lose consciousness, you should seek medical attention right away. Also, if the dizziness is accompanied by other symptoms like chest pain, shortness of breath, blurred vision that doesn't go away, or a severe headache, it could be a sign of a more serious underlying condition. Your body is great at sending you signals, and it's our job to listen to them. Don't dismiss persistent symptoms. A doctor can perform a simple test, like measuring your blood pressure while you're lying down, sitting, and then standing, to properly diagnose orthostatic hypotension and rule out other causes. Remember, feeling dizzy when you stand up is common, but it's not something you just have to live with. By understanding what's happening in your body and making some simple, mindful changes, you can often manage it effectively. Stay hydrated, move slowly, be mindful of your meals, and don't hesitate to talk to your doctor. Taking these proactive steps can not only help you feel better, but also keep you safe from falls. Thank you so much for joining me today. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up and consider subscribing to the channel for more health tips that are easy to understand and apply to your daily life. Share this video with someone you care about who might be experiencing this. Let's look out for each other. Stay safe, stay healthy, and I'll see you in the next video.